Now, hospitals in the area have been preparing for this new variant, but are still waiting, like the rest of us, to see what a new variant means for a healthcare system.
And Mike McDaniel is joining us in the studio tonight to explain how the hospitals are getting ready and what concerns that they have. I imagine there are many.
Yeah, you would think tonight here in this news that there will be a lot. Of course, while this is some concerning news, medical leaders knew this was only a matter of time before it showed up here in Louisiana. It just showed up a little faster than some may have thought. With this case here in the New Orleans area, hospitals in southeast Louisiana, of course, paying close attention. Already aching from fatigue, medical professionals hope the new Omicron variant doesn't mean a new surge in hospitalizations.
It's causing a lot of angst, and I understand that, but it's not time for people to panic.
But Dr. Sandra Kemmerly with Ochsner Health says it is time to be prepared. With the variant being so new, Dr. Kemmerly says it'll take up to 2 weeks before we know how transmissible and severe it is.
We have no way to predict if Omicron will be similar, but if it turns out to be like Delta, we'll flex and we'll figure out a way to take care of the patients.
It's the same view at rural hospitals like Our Lady of the Angels in Washington Parish.
We're not sure what to expect. With each one of these 4 prior spikes, we've had to be adaptable.
Dr. Garland Anderson says there is one concern, though, getting enough supplies to treat a surge of patients amid an already crippled supply chain.
It's not a remote phenomenon. This happens across our region, across our state, across the country, and those supply chains get interrupted very quickly.
With the first probable case of the Omicron variant reported in Louisiana Friday evening, doctors say procedures from the Delta variant are part of the advantage.
We have, surveillance sequencing ongoing. We're going to be able to tell pretty quickly when Omicron does arrive and what it does in our population.
A big unknown is whether vaccines are effective in that population.
COVID-19 continues to be a vaccine preventable illness for majority of cases. We don't know if this new Omicron variant is going to change that picture.
Vaccine testing is underway by manufacturers. Dr. Kemmerly says with the fact all variants share the same structure, there's some optimism there.
At the end of the day, there should be some protection against Omicron and maybe other future variants that have not yet been identified.
In the meantime, it's about identifying needs for an unknown. Mike McDaniel, Eyewitness News. And of course, medical leaders continue to stress the importance, especially tonight, in getting vaccinated and getting that booster. They also encourage everyone to wear a mask and social distance when you can. Charisse?
Mike, thank you so much.